Hello, everyone. It is a pleasure for me to be speaking to you, and I want to thank you for attending this webinar. I would also like to thank Philip Sonicare for sponsoring the webinar. We're going to be talking about complementary, alternative, and integrative health and understanding some of the drug and supplement interactions. Considering the pharmacological interactions between herbal medications and conventional medicines, it's really important to increase awareness and knowledge of healthcare professionals, dentists, dental hygienists, physicians, about herbal medications. Interesting, one survey in the United States has shown that the use of CAM, or complementary and alternative medicine, is more widespread in younger people, with an incidence of about 30% in individuals 54 years of age or older, 50% for those 34 to 53 years of age, and 70% for individuals 18 to 33 years of age. And also, somewhat unexpectedly, the use of CAM for general health and well-being is amplified in people with higher education and income rather than individuals with lower education and lower socioeconomic status. And the other thing we need to keep in mind is because CAM, or again, in alternative medicine, including herbal medications, could be tied to cultural and ethnic traditions. So it's really important that we assess the use of these products in a way with an understanding that there may be possible barriers to disclosure. So at the end of the course, I hope you will be able to evaluate common drug supplement interactions, discuss certain medications and supplement use and the effects on the liver, identify the differences between the different types of medical practices, Western, Eastern, and I have really a plethora of resources that will be available to you. At the end of the webinar, you can go, there is a handout that I have provided with all of the websites, so you don't have to be writing all of the websites down. You will have those in a PDF handout. So these are some of the definitions. A non-mainstream practice is called a complementary type medicine, and this is used a lot of time with conventional or Western medicine. If it is not mainstream, you've probably heard of a lot of people going, for instance, to Mexico or Thailand. That is called alternative medicine. And we finally are getting to something called integrative models, where we bring together the complementary and conventional approaches in a coordinated way and try to understand it. These complementary and alternative medicine is a group of diverse practices, medical practices, healthcare systems, and products that aren't traditionally considered to be part of what we consider Western or conventional medicine. Could be natural products, prayer, massage therapy, all of the things you see here, energy medicine, manipulative processes like chiropractic, things of that nature. It has been estimated that 30 to 40% of the general population have used or are using complementary and alternative medicine in the past year. In the United States, herbal medications are considered dietary supplements, and they're regulated by the Dietary Supplement Health and Education Act. In Canada, herbal medications are classified as natural health products, and they fall under the jurisdiction of the Natural Health Products regulation. You can see here some of the complementary approaches that are used, natural products being number one. And I think we need to be careful because natural products are not necessarily safe products just because they're natural. But look at some of the other things here, special diets, homeopathy, guided imagery. All of these things are a little bit out of the mainstream. And as mentioned, the use of complementary and alternative medicine is a little difference between older people and younger people. In this particular study, which was published in the American Journal of Geriatric Psychiatry, they actually showed that baby boomers were more likely than pre-boomers to report utilizing CAM for a mental disorder. This is specific to a mental disorder. And among those, the higher proportion of baby boomers reported utilizing most individual modalities. The only practice used by younger people were prayer and spiritual practices, which seems to be popular with lots of people. We have, as part of the National Institutes of Health, we have the National Center for Complementary and Alternative Medicine, or Integrative Health. And the mission is to build scientific evidence around these types of modalities. Their mission is to define, and they want to do it through rigorous research and investigation, the usefulness and the safety of these interventions in improving healthcare. Some of these modalities have been around for thousands and thousands of years, and many of our medications are derived from some of these herbal products. So the vision is to collect scientific evidence that informs the decision making for the public, for healthcare professionals, and for policy makers as well regarding complementary and alternative practices. You can see here that conventional healthcare is primarily what is being used today, physician visits, prescription drugs, but we can see here that complementary practitioner visits and non-vitamin and natural products are starting to become more popular. In the United States, as I mentioned, herbal medications are considered dietary supplements. And that means any product, not including tobacco, it's intended to actually supplement the diet. And it is considered one of the following: a vitamin, a mineral, an herb or a botanical, an amino acid, a dietary substance to supplement the diet, or any part of the above. So that's kind of the technical term for an herbal medication. Part of the problem that we have is there is limited or a paucity of evidence about not only the efficacy but the safety of these herbal medicines. We have small numbers of study, and a lot of the research is from international sources, and the primary research is of poor quality. So there's not a lot of understanding as far as I mentioned, not just the efficacy, but the risk to safety from these herbal medications in practice. And do bear in mind that they aren't regulated by a governmental agency, for instance, the FDA or the Food and Drug Administration. We also need to identify educational standards for training practitioners. What is the benchmark for accrediting practitioners to understand the use of herbs and supplements? We also need to know interactions, herb to herb, herb to pharmaceutical, over-the-counter drugs. What are these interactions and what are some of the side effects? So again, we need to do a lot more research. One of the studies here showed that there has been a lot of adulteration of some of the proprietary Chinese medicines, and they pose major health risks. Some of them contain things that are undeclared, some prescription drugs, drug analogs, or even some of the things that have been banned in the US and in other countries. Changes in these fillers or other drugs can have serious and sometimes fatal consequences. In this particular study, the sources of the illicit products included the over-the-counter drugstores, the internet, and Chinese medicine practitioners. As you well know, you can get anything you want over the internet. And 65% of these people experience adverse events from these illicit products, and there were 2 fatal cases here. So this is something very serious, and until we can actually control what are in some of these products, we need to be very careful. Some people think that barcoding or some way identifying some of the items within a product will detect contamination and substitution in some of these products. So they're looking at various ways to accomplish this. So when we're talking about interactions, in addition to a physician or a nurse practitioner or a physician's assistant, many other healthcare professionals need to know what people are taking. Oral healthcare professionals, dentists, dental hygienists, any specialist in the medical field, eye care professionals, and very, very importantly, emergency room or urgent care facility personnel. If people are taking some of these drugs, it can change their bleeding levels, etc. So it's really, really important. And as well, it's important for all of us and patients to tell complementary health practitioners, chiropractors, and naturopaths what type of things are being consumed. So how do we look at drugs and herbs and how they are in the body? Well, one of the things is pharmacokinetics, and that is the study of the effects exerted by drugs or other items on the body, how they're absorbed, how they're distributed throughout the body, how they are transformed, and how they are eliminated as well. And pharmacodynamics is the fact that something is interfering with the interaction between a particular drug and its molecular target. In most cases, it would be a receptor. Now, sometimes you can get some of these things happening at the same time, but rarely do you see them happening at the same time. They're usually two separate chain of events. So, herb and drug interactions do occur a little bit less frequently, and they're usually a little less serious than drug-to-drug interactions. And that's primarily due to the weaker potency of herbal medications. However, interaction and adverse events may be underreported, and relevant information may not be collected. So what we can see is increased metabolism of a drug, which reduces the concentration in the blood and in the body, and may reduce its effectiveness. Or an herb, as an example, can cause decreased metabolism of a drug, which increases the concentration in the blood and can lead to toxicity or increased side effects. So these are important bodily kinds of things. Example, this herb, St. John's wort, as an example, may slow down processes in the body that change drugs into inactive substances. So if you take this herb while you're taking a different drug, the amount of drug in your body may increase. As a result, that drug may be too strong in your body. So St. John's wort is well known for decreasing the effect of drugs. It does so by speeding up the processes and the metabolism in the body, changes the drugs that you may need for heart conditions or spasms or MS or any number of other things. It can change these drugs into inactive substances. Actually, it has been known to decrease the effectiveness of more than 70% of all drugs. This is important because St. John's wort is used extensively, especially in other countries. You can see here some of the types of drugs, and there's a very long list of drugs that interact with St. John's wort. So the other thing to keep in mind is combining St. John's wort with certain antidepressants can lead to potentially life-threatening increase of serotonin. And serotonin is the brain chemical that's targeted by antidepressants. Psychosis is rare when taking this drug, and it actually may help. This is one of the herbs and drugs that may help mild to moderate depression, and it works similarly to standard prescription antidepressants, but the evidence is not extremely robust. You certainly don't want to use St. John's wort to replace conventional care or postpone seeing your health care provider, because if you have depression and it's not treated, it may become severe, and in some cases is associated with suicide. So keep in mind, again, that this drug is used extensively. In Germany, as an example, it is used much more prevalent than, for instance, the antidepressants that are used in the United States. You can see here some of the other interactions with over-the-counter drugs, and these can be very serious depending why you're taking them. Aspirin, a lot of people take aspirin to thin their blood. If St. John's wort is interacting, you may then have a higher tendency, for instance, of a blood clot. Things like birth control pills, and I think it's quite obvious if St. John's wort interfere with the action of birth control pills, you may have an unwanted pregnancy. Other side effects are usually minor and include things like an upset stomach and sensitivity to sunlight, not unlike tetracycline. So it is a stimulant in some people, and it could actually increase feelings of anxiety. I'm sure you've heard of people having an opposite reaction to certain kinds of drugs. So when are these interactions really, really important? And that is when you're taking a drug that has a narrow therapeutic range. Look at some of these drugs here. They're used to treat some very serious things: seizures, transplant rejection, heart problems, thyroid problems, seizures, blood thinners here. And it's also important when you're going to have surgery, as an example. So the therapeutic index is the range of doses at which a medication is effective without unacceptable adverse events. So if there is a narrow therapeutic index, then the window between the effective dose and the toxic dose is very small. So we need to be very careful about some of these drugs. Some drugs are obviously a little bit safer than others. So some dietary supplements may cause problems during surgery. This affects response not only to the surgery itself, but to the anesthetics and other medications that are given before, during, or after the surgery. Many of these supplements do have the problem of increasing your risk of bleeding. So that's something that you obviously need to take in mind if you're being cut. And so many healthcare providers will ask patients to discontinue all herbal supplements several weeks before having elective surgery. Obviously, if it's an emergency, then that can't happen. So this was a study that showed that herbal supplements may cause dangerous interactions with orthopedic surgery patients. Valerian, which is similar to St. John's wort, used as a sedative, can intensify the effect of anesthetics. It's common sense. St. John's wort, we talked about, can interact with some of the immunosuppressant drugs like cyclosporin, potentially lead to transplant rejection, clotting issues, hormonal issues like black cohosh. So if you're planning surgery, you need to be aware that your healthcare professional may ask you to stop 1 week, 2 weeks, 3 weeks prior to taking it, because you want to avoid potentially dangerous changes in your heart rate, blood pressure, and bleeding risk. Some very serious issues there. So this is a brochure from the American Society of Anesthesiologists. This one happened to come from the Idaho Society of Anesthesiologists, and it talks about herbal and dietary supplements and anesthesia, and gives some ideas of what you should do if you are having surgery. And you can see here how long it can increase the risk of bleeding, it can raise blood pressure, interfere with other medications, and things like that. So these are very important, and it's not, it's out of the question for us to be able to refer people to these websites if we know they're going to have surgery. Assuming many of the people on this webinar are oral healthcare professionals, so whether it's periodontal surgery, oral surgery, maxillofacial surgery. So we do have a responsibility to take a good medical history and be able to help our patients. Read labels. However, not everything on the label may be correct. This was a study that looked at labels, and what they found is that most labels in the study had incorrect information. Many of the herbal products that they tested were of poor quality, including product substitution, contamination, fillers, and these authors suggested that the industry should embrace some kind of a coding system for authenticating products and quality control through testing of the materials that are used in the manufacturing process. But because it's not mandatory, a lot of the manufacturers do not care to do so. And you know as well as I do that there are some companies that have better reputations than others. So if you were going to use these kinds of products, make sure you use a reputable company. In their analysis, it was discovered one or more banned pharmaceutical adulterants were found in 66.7 of the supplements. And this was in particular for sports enhancement supplements, weight loss supplements, and sexual enhancement supplements. So, a lot of people are taking these kinds of herbs thinking that they're miracle drugs. And in some cases, you're not even getting what you've paid for. So, this is one of the better sources. It's Medline Plus. You can browse. They have a section on dietary supplements and herbal remedies, and you can learn about the effectiveness, the doses, the interactions with drugs and other herbs. And as I mentioned, all of these websites are in the handout that you can download. The other thing to keep in mind is that most of the things that we ingest are either metabolized in the liver or in the kidney. Because most of these herbs are metabolized in the liver, there are liver injuries as a result. The proportion of liver injuries caused by herbal and dietary supplements rose from 7% in 2004 to 20% in 2013, according to a study in July 2015 in the World Journal of Hepatology. So this is a very serious thing. Herbs like comfrey tea can injure your liver. Green tea extract, kava, comfrey, others. Because of this, Liver Talks has been instituted. It is a website. It provides up-to-date, accurate, and very easy to understand information on diagnosis, cause, frequency, patterns, and management of liver injury that is attributable to these prescription and non-prescription medications, including herbals and dietary supplements. There is also a case registry there, and it's a very, very comprehensive website for not only physicians, but for patients as well. 7 tips to keep your liver healthy. Beware of the biggest offenders, and that is green tea extract, anabolic steroids. Weightlifters use this a lot. Pyrrolizine alkaloids and flavocoxoid. Sometimes these things are used to treat arthritis. So know what's in what you're taking. Check the Liver Talks website. Don't always trust the label, and be sure you talk to your healthcare professional. One of the things to keep in mind, though, if you like green tea, if you drink green tea, we're not talking about that. We're talking about green tea extract being very, very different. Drinking up to 10 cups a day is safe. It's the high doses of the extract found in weight loss supplements that causes the damage. So I don't want everybody to stop drinking the green tea. So there are new guidelines that warn of liver damage from herbal supplements, over-the-counter and prescription drugs, and this is from the American College of Gastroenterology. And they talk about things like idiosyncratic drug-induced liver injury. A rare adverse drug reaction, difficult to diagnose, can lead to jaundice, liver failure, and even death. And it still is, it's not easy, so it's a diagnosis of exclusion that the physicians will do. It underscores the importance of patients telling their doctors and physicians and nurse practitioners a full history of what they are using. And the other thing to keep in mind, green extract does top the list as one of the most common dietary supplements, as we talked about, for drug-induced liver injury. So just to give you a context, an average cup of green tea has anywhere from 50 to 150 milligrams of catechins, which this is a group of polyphenols that they're active ingredients. And in some of the green tea extract pills, and again, these are mainly for weight loss, the levels are over 700. milligrams. So they go from 50 to 700. That is why you need to be very, very careful in what you're taking. And the frequency of drug-induced liver injury is increasing as the use of herbal and dietary supplements are drastically increased over the last 10 years. A good example is a lot of people take iron supplements and they're not iron deficient. So if you're taking too much iron, that's a problem. And the other kind of thing is vitamin A. Some of these vitamins are not water soluble, they're fat soluble. So you shouldn't exceed recommended doses. And a lot of people do so, thinking that more is better. So let's talk about doctors being able to discuss herbal medication use with heart patients. This was another study that was done. The researchers in this review looked at 42 herbal medications that have a possible indication for treating cardiovascular conditions, hypertension, heart failure, vascular diseases, high cholesterol, things like that. And then they selected 10 of the most commonly used in cardiovascular medicine, and they looked at the indications, the clinical data, and the safety concerns. And what they found is that physicians need to improve their knowledge. Most physicians do not have enough knowledge to adequately understand the clinical implications related to their use. So, and they also should explain to patients that natural does not necessarily mean safe. It's commonly and erroneously assumed by patients that something is natural, it's intrinsically beneficial and devoid of adverse effects and interactions. And we know that that is not the case. So not only do patients have to be informed about all this, but healthcare professionals need to understand as well. So I'll go through a couple. Obviously, there's not a lot of time to go through many of them, but these are some of the more common products that you will see in your pharmacies, your Walmarts and CVS and Costco's and things like that. So the acai berries became very popular, is used for preventing things like heart disease, cancer, stroke, autoimmune disorders, to treat allergies, diarrhea. And the berries and seeds contain antioxidants. So yes, they may have some small effect. There aren't a lot of good studies around this particular product, but do understand that it may interfere with actions of certain chemotherapy drugs because it does exert, even if it's small, an antioxidant effect. Beta-carotene, reported uses, prevention of cancer, cardiovascular disease, cataracts, immunostimulation, and there was one study, or a couple of studies actually, that have shown that beta-carotene can induce the remission of oral neoplasia. There was another study that actually showed, though, that taking beta-carotene in conjunction with alcohol, heavy alcohol use or abuse, has potentially very, very serious side effects. So again, these interactions are things, this was a study that was done in the Netherlands. Black cohosh, which is used primarily by women for treatment of menopausal or postmenopausal symptoms. It is still a bit unclear whether it has estrogenic effects. However, it may exert even a small one. So women that have estrogen receptor positive cancers should avoid this kind of supplement or any other supplement like soy that might exert any kind of estrogenic effect. And so it will interact with things like tamoxifen and some chemotherapy drugs, and it may interact with drugs that are metabolized by the CYP3A4 enzyme. So, the breakdown of some of these herbs and drugs interact with one another. Clinical trials of black cohosh have found that black cohosh is really not any better than a placebo for hot flashes. And this is one of the reasons that women take this as in postmenopausal years. So you can go to any of the resources that I have put in the handout, and you will see a lot more about black cohosh and other kinds of things used by women for hot flashes and other problems with postmenopause. And there's some confusion about the safety of these plant-based estrogens because they have property that can cause estrogen-like effects in some cells, and then in other cells they have anti-estrogen effects. So something that everybody reacts differently, and these drugs and herbs may act differently as well. A kind of new thing is the blue-green algae or spirulina. This is used for weight loss, appetite suppression, ADD, cancer prevention and treatment, some studies with oral leukoplakia. Some of the studies show that this might be effective against allergies, especially allergic rhinitis, for managing diabetes, and for lowering cholesterol with people that have certain types of hyperlipidemia. So preliminary data show that it might be a safe and effective agent in the treatment of chronic hep C virus infection. And again, it can inhibit some metabolism of certain enzymes, causing accumulation of these drugs, thereby increasing their side effects. Calendula. Calendula is a part of the Asteraceae family, and it's a very large family of flowers, if you will. The aster, the daisy, the sunflower, and things like that. So these are the purported uses: conjunctivitis. It's kind of anti-inflammatory, so used for eczema, for women, menstrual cramps and other disorders, spasms, varicose veins, and it can also be used topically for wound healing. And because of some of the properties that it has, such as some beta-carotene properties, as well as anti-inflammatory products. You obviously do not want to take this if you are allergic to anything in the plant family, so to speak, or if you are pregnant or lactating. That brings up another point, that there is really no safety data for pregnant and lactating women. Only recently have we started to get some decent studies on pregnant women, because drugs were never tested on pregnant women because they didn't want to take the chance of damaging or injuring the fetus in any way. But we have to understand that if you do not test drugs on pregnant women, then when they take drugs that are needed, and obviously pregnant women have other issues, that they may have MS, they may have rheumatoid arthritis, they may have many other kinds of things. And if they're taking drugs that are not tested, they're guinea pigs. So it is better to have a controlled clinical trial so that we know. But again, these herbs have not been tested in pregnant and lactating women. So capsaicin is, you see this often in over-the-counter creams such as Zotrix, Salonpas, and Sinus Buster. The uses for it is, pain relief, things from arthritis, osteo or rheumatoid arthritis, headaches, neuropathy, whether it's herpes neuropathy or diabetic neuropathy or HIV neuropathy. So pain, inflammation, and muscle spasms, and you will see these. You don't want to take these if you're taking ACE inhibitors, because this particular herb can increase the incidence of coughing. And sometimes if people take ACE inhibitors, they develop a chronic cough, and capsaicin can actually increase this. Also, if you have any problems with your blood pressure, if you have heart disease or other cardiovascular conditions, and again, if you're taking certain drugs, so if you have unstable or poorly controlled hypertension, Or if you've had a heart attack or some type of cerebrovascular event, this may cause an increase in the risk of adverse reactions and cardiovascular effects. Coenzyme Q10. And the other thing, before I want to go back just for a second here, I forgot to mention that the cream form of this can be very irritating to mucous membranes, the eyes, broken skin. So you want to avoid spreading this cream if you're using it for pain to sensitive areas, and wear gloves to apply it, and then wash your hands with soap and water afterwards, because the analgesic effect is multifactorial. It can, in some rare cases, cause serious burns, and certainly you want to discontinue the use and seek medical attention if you have pain or swelling or blistering, which would indicate that maybe you've burned yourself. So, and also, if you are using this to treat pain, it could take several weeks of 4 to 5 applications a day to start working. So don't, use it as directed. Do not use it more because it doesn't seem to be working. It is one of those drugs that can take a while to become effective. Coenzyme Q10 is produced naturally by all cells in the body. It's necessary for the production of ATP, which is the fuel for all of our living cells. And it is used for a lot of cardiovascular kinds of things, cancer prevention, chemotherapy side effects, hypertension, infertility, periodontal disease. They have not done too many studies here. One study supports its use, but of course, one study is never enough to cause us to change what we do. Absorption of oral coenzyme Q10 through the intestine is low, and that is why a lot of time people use patches and other types of routes of administration rather than orally administered, because a lot of times when any kind of medication goes through the GI system, it is there's not much after metabolism, to go to the site where you want it to go. Due to its antioxidant activity, coenzyme Q10 could interfere again with actions of certain chemotherapy and radiation drugs. So you also don't want to take it if you're taking something like anti-clotting, like warfarin, if you're undergoing chemotherapy, or if you were taking theophylline, because coenzyme Q10 delays the clearance of theophylline, so it causes more of it to stay in the body, which may cause persistent vomiting, cardiac arrhythmias, and seizures. So it seems very innocuous, but again, you have to read all of the things that these things can do. Comfrey is a plant, and even though this plant contains poisonous chemicals called pyrrolizidine alkaloids, or PAs, the leaf, the root, and the root-like stem are used to make medicine. The amount of PAs, or the alkaloids, found in comfrey changes according to the time of harvesting and where it's found on the plant. For instance, the roots have 10 times higher amounts than the leaves. So the produces, as you can see, bronchitis, cancer treatment, inflammation, peptic ulcers, rheumatoid arthritis. However, the bottom line with this, I don't care what type, whether it's tea or tinctures, it has not been shown to do anything good, like to treat or prevent cancer, and several cases of liver toxicity have been reported with its use. And as a matter of fact, on July 6, 2001, the US FDA advised all dietary supplement manufacturers to remove any products containing comfrey from the market. They are toxic to the liver and can cause liver cancer. Goldenseal, topically it's used as an antiseptic and systemically to treat some GI disorders and menstrual pain, infections, inflammation, hypertension, cold, flu, and urinary tract infections. So Again, it inhibits and prevents metabolism of certain drugs. So it leads to abnormally high levels of certain drugs like erythromycin in the bloodstream and can cause some serious side effects. Also, adverse interactions with clotting, like warfarin, heparin, cyclosporin, which is used for organ transplant rejection, digoxin, and anything metabolized by the liver. So a lot of people use these herbs for either cancer treatment, cancer prevention, and sometimes the side effects caused by cancer treatment. So there are lots of websites. Again, this is in your handout. It talks. This is from cancer.gov that talks about using any of these things for cancer. There is no strong human studies that these can treat, prevent, or cure any type of cancer. There are some trials that show that some of the Chinese herbs may help people to live longer, reduce side effects, and help prevent cancer from coming back. But this is a lot of times when it is combined with more conventional therapy. And again, this is integrative medicine. I have a friend whose dog has cancer, and so even in veterinary medicine, her dog is taking some mild chemotherapeutic drugs, but is also taking some Chinese herbal medicine and is controlling the cancer very, very well. So integrative medicine, I think, is where we want to go. Before we wind up, I want to talk about cannabis because this has become a very serious issue in the United States and around the world. And so many people feel that it's innocuous because it's becoming legal. You can assume that 1 out of 4 teenage patients being seen for surgery is using some form of marijuana or hashish. Cannabis and cannabinoids are also known as marijuana, and they can have some potential medicinal effects. For instance, antiemetic, helping with vomiting from side effects from chemotherapy, appetite stimulation, pain relief, improved sleep. However, the FDA has not approved cannabis as treatment for cancer or any other medical condition, just to help with relief from side effects. Components of cannabis called cannabinoids activate specific receptors in the body, specifically in the central nervous system and the immune system. You can buy commercially available products such as dronabinol and nabilone, and these are approved drugs not for the treatment of cancer, but for cancer-related side effects. So they may have some help, and this is why it has become legal. Because this has become such a big thing, the National Academies of Science they just a little less than a year ago issued this document in January of 2017 about the health effects of cannabis and cannabinoids and where we are with the state of science. Because so many states now have legalized it not only for medical conditions and side effects, but also for recreational use. It is available in edible forms. You've all heard of brownies, oils, and also a variety of inhaled substances such as smoking it. These are just some of the highlights. In adults that have nausea and vomiting from chemotherapy, oral cannabinoids can be effective. In people with chronic pain, they can sometimes find a relief in pain symptoms. People that have MS have reported less spasticity of their muscles. And even though the effects are modest, they may be there and they may help these individuals. But for any other kinds of conditions, there isn't really a lot of evidence to suggest that they are helpful. Smoking, on the other hand, is a very different issue. Smoking anything is harmful just because the act of smoking is damaging to the lungs. On a regular basis, it's associated with chronic cough, phlegm production, and can cause, if you stop smoking, whether it's cannabis or anything, you can reduce the cough and the phlegm production. And it is unclear whether it is associated with chronic obstructive pulmonary disease or asthma or worsened lung function. Again, the evidence just isn't there yet. The evidence does suggest that smoking does increase risk for cancers. There's modest evidence associated with some type of cancer, and there's not a lot of evidence that parental cannabis use during pregnancy is associated with greater cancer risk in the offspring. There's not a lot of evidence about therapeutics on the human immune system. So we just don't have a lot of evidence as far as the immune system or anti-inflammatory activity of these substances. So we can't really support or refute the fact that it has effects on the immune system or individuals with HIV. We know that cannabis prior to driving, just like drinking, alcohol increases the risk of being involved in a motor vehicle accident. The risk, where it's legal, increased risk of unintentional cannabis overdose injuries among children is becoming rampant. I actually just read something today before doing this webinar that the ERs are being inundated with children that have eaten gummies or other things that have cannabis in them and have hurt these children. So there's a lot of other information. We know that it does impair cognitive domains of learning, memory, and attention. And even if they smoke, they still have some impairment. And if you use it during adolescence, subsequent academic achievement is sometimes decreased. So read this document. It's very, very helpful. In pregnancy, smoking cannabis is linked to lower birth weights, and that is about the only thing we can say definitively. And if somebody is smoking it, there is, and if they're doing it on a regular basis and a lot, they can develop a problem cannabis use, and it can be habitual. And the younger age, of course, the higher the risk there. So when you talk about mental illnesses, cannabis is likely to increase the risk of schizophrenia. The higher the use, the greater the risk. And so there's a lot of other things here. Heavy cannabis users more likely to report thoughts of suicide and social anxiety disorder. Intraoral effects, irritation of oral tissues, xerostomia. The high temperature can cause burning and periodontal disease in a small amount of studies. There is only a small animal study that shows that smoking marijuana has a negative effect on implant healing times. It can then increase the risk of infection or dental implant failure, and that the actual mechanical action of creates a vacuum which can impact the ability of the implant to integrate with the jawbone and cause failure. So just like smoking cigarettes, dentists typically recommend avoiding smoking 2 weeks before and 8 weeks after getting an implant. It definitely can affect anesthesia. This is extremely important, and so you must, it can increase bleeding, increase oxygen consumption, can lead to below safe levels during surgery. So it's important to understand this. Marijuana smokers have to be on a ventilator longer. They can develop pneumonia, and it also can change the dose needed for sedation. Very important for us to discern if somebody has been smoking marijuana prior to surgery. Marijuana causes blood vessels to vasodilate, can cause blood pressure to fall, heart rate to increase, and so it can cause some very serious issues. So also marijuana use confers a threefold risk of dying from hypertension. I have given you all of these references so you can go back and read it. All of these resources are available to you. They are in the website. Memorial Sloan Kettering has a really wonderful and helpful website about herbs and benefits, adverse reactions, interactions, and things of that nature. Here is clinically relevant herb-drug interactions. It's a video, which is very helpful. Here is the National Center, the NIH, that has a section, the National Center for Complementary and Integrative Health. Again, all of these are in your handout. Medscape has a drug interaction checker, and also the FDA has some information for you as well. So one of the things too, and if you go into the FDA website, there are downloadable brochures. This one in particular talks about the use of dietary supplements, talks about pregnant women as an example, folic acid, women with children, women with other types of health problems who may be taking medications, and urging these individuals not to take supplements instead of their medications. And if they are going to use them in addition to make sure that the healthcare providers are well aware, because again, these interactions are not something that are commonly known, sometimes even to the physicians. And it gives a lot of information from the FDA. Here is a slideshow that talks about herbal supplements with risky drug interactions. So I will try to take a couple of questions in a few minutes, but I hope that now you can evaluate some of the common drug supplement interactions and discuss medications and supplement use and their effects on the liver. Identify the differences between the different modalities, complementary medicine, alternative medicine, and integrative therapy. And now you know you have all these resources that are available for you. So let's see here. I'm going to do a poll here very quickly. So complementary and alternative medicine. It's a group of diverse medical and healthcare system practices and products that are not presently considered to be part of conventional medicine. Natural health products, prayer, massage therapy, or all of the above. I know this one's pretty easy. All right. So you can see there. Okay. We're going to go back here. So let's see here if I can see what some of these questions are. Which herbs react with antibiotics is one of the questions. There are numerous herbs, and I can't sit here and give you a list of them, but I do suggest that you use the handout that I provided. There are, on those websites, they give you some of the very common interactions. You're welcome. I have patients that use cinnamon pills as opposed to green tea extracts. Do you have any information regarding cinnamon? I do not have information regarding cinnamon, but I am sure if you look it up, it's not one of the websites that I've given you. You'll be able to get some information. Thank you all for your thank yous and your positive comments. Let's see. Is green tea extract the same as green tea? No, it is very different. You can drink up to 10 cups of green tea a day with absolutely no problem. We are talking about the green tea extract that is in weight loss, particularly in weight loss supplements. So, so yes, you could, you're talking about 50 milligrams versus 700. So green tea by itself is fine. So no worries about that. Let's see. I'm trying to go through some of these questions. I'm sorry if somebody lost sound. Hello from Maine. Hello from California. Let's see. Wow, unaware how many drugs. St. John's wort. Yes, there is something called, I believe it's called Commission E in Germany, and they regulate drugs and herbs, and St. John's wort is used probably a lot more than the anti-anxiety meds that are commonly prescribed here in the U.S., and we know that it's, you know, lots and lots of people take these drugs. But in other countries, especially Germany, that St. John's wort is very, very common. Can you repeat the link to download the handout? I don't have the link. If you stay on where you signed in, it is right where you signed in, because I can't see it from where I am. It's in the classroom page, just for your information. And somebody mentioned that cinnamon helps diabetics and reduces sugar in the system. So thank you very much. I appreciate that information. There are many stats on turmeric, health drinks. Turmeric is something also that is new. And there are some pretty good some studies, but again, you have to look at the dosage. By the way, handout classroom page is called webinar handout. Oh my goodness. Dennis, friend of mine, took handfuls of herb supplements every day. He died from pancreatic cancer. Well, some of these herbs, if taken in extreme amounts, can cause cancer. So is why he died of pancreatic, or why he got, I can't honestly say that, but that is, that's very sad. I'm sorry to hear that. How is herbal medicine different from conventional medicine? Well, herbal medicine is considered either alternative or complementary. So many of the medications that we use today are born from, like aspirin and other things, from herbs and things from a long time ago. But now the pharmaceutical companies have done studies, and they have looked at the dosage, the amounts we need, the effects, the side effects, and the any kind of adverse reaction. If you just take an herb that is not regulated, as an example, it is different from a pharmaceutical that has had studies. So herbal medicine is considered alternative or complementary, so it is different from complementary, or excuse me, conventional medicine in that. How long does it take for herbs to be effective? I think that it depends on the herb. I think some of them are different. So if you go again to some of the things I put in the handout, you can look up certain herbs, and you can get, especially the NIH website, the National Institute of Complementary and Integrative Medicine, you can plug in any herb or supplement and you can get information on it. Are the beta-carotene studies based on supplements or actual foods? I can't honestly answer that question because I don't have them in front of me. If it is a supplement, then the study would have been done on a supplement and not on the food itself. Let's see. Do you have any idea about Garcinia cambodia? It's said to be a natural product also for weight loss. I do not know a lot about it, but I would use any weight loss or appetite suppressant product with great caution. Many of these things have uppers in them and pharmaceuticals that have been banned. So I would be very careful. Grapefruit, what about grapefruit usage? Honestly, I don't know what that means. Apple cider vinegar, I don't think there's any adverse effect, but you don't want to overdo it. Echinacea interactions, thank you for your compliment. Echinacea does have some anti-inflammatory effects, so you have to be very careful what you use it with, and it can be a problem. So let's see. if I know the FDA does not regulate supplements, vitamin data have certain. I don't know about these certifications, so and I'm really sorry that we're running out of time. So if you have my email address, it is also in the handout. If there are any questions that I can try to answer for you that I haven't been able to get to, please email me. Thank you so much for all of your information and your compliments and for all your attention. Thanks very much.